Now, nobody ever wants to get sick or injured, but when you or someone you know does, did you realize you could be helping other folks avoid the same sickness or injury in the future? And to help us better explain what I'm talking about, we're happy to have with us this morning the president and CEO of HEALTHeLINK, Dan Parecka. Dan, thanks for being here.
Well, thanks for having me, Kevin.
You've been on the show before, but some folks might be the first time seeing you or hearing about HEALTHeLINK. Can you explain quickly what it is?
Sure. We are the clinical information exchange or health information exchange that supports the 8 counties of Western New York, 8 westernmost counties. We're here to support providers, helping them make better decisions on behalf of their patients. And we've kind of expanded our role with the merger a couple of years ago with the Population Health Collaborative that brings regional health improvement into kind of our mission. It's expanded our mission, and we're looking for more ways to leverage the investment that's been made in HEALTHeLINK and the data that we've aggregated to make better, to support the community in a better, more efficient way.
Now, this is something that patients sign up for. Do they sign up with a provider? They sign up on your website, and by doing so, their health goes into data, if you will, correct?
Right. So patients unlock the ability to use the data that we receive from their doctors and the hospitals and the labs and radiology centers. So that cannot be accessed without a patient's consent. That's what they're signing up for. And we've had a tremendous success in getting, where there's over 90% of the patients in Western New York have signed a consent form and said, yes, I want my doctors to have access to my data. We're able now to leverage and use that data in more, in a broader manner, where de-identified, that data can be aggregated, and then we can look at, for example, where are hotspots in their communities, right down zip code, down to census tract level for certain disease. And so we can look at, health equity. Are there certain areas that need some more attention that we can put a spotlight on? And then secondarily, as investments are made to try and address those challenges, are those investments making an impact? So we can look at the clinical data, right? So when you think of health-related social needs and those things outside the healthcare system that impact health and well-being of an individual, food insecurities, sure, transportation, can they get to their doctor's appointments? Those things are outside the clinical realm, but have an impact on the patient and their health. Are these investments made in those areas having an impact on the health of the community that we're trying to serve?
Sure, yeah. In the micro, the patient, doctors, or whoever they see, whether it's emergency room, whatever, gets their information looked at so they know what to be treated. In the macro, the data, not your name, but the data goes into the system to see what challenges people are facing. I want to talk, I said that correct, right?
Yeah.
Yes,
yep.
okay. Federal funding.
You're hired.
Federal funding, you recently received some to help even expand those efforts. Tell us about that.
So yeah, we've expanded we're always looking at ways to better serve the community. One of the big challenges is end-of-life wishes for an individual. So advanced care planning, advanced directives, those kinds of that kind of information being made available in the emergency room when a patient can't speak for themselves. Those forms are getting filled out. They're paper. My mom had one. She was 94 years old. It was sitting on her refrigerator. It was a pink form that was put on her refrigerator. That's what she was told to do. Didn't do her any good when she collapsed at my house, right? But I knew her wishes. I was her healthcare proxy. And that's an important thing too, right? So technology is only part of it, right? Conversation with your loved ones as to what your wishes really are will go a long way. But having the ability to get those wishes documented in electronic form, that's what the federal grant that you're referring to is enabling us to do. There's an investment being made over the next couple of years to bring in those advanced directives, those forms that are filled out at the doctor's office, the hospitals, the long-term care facilities, get them aggregated, put together in one place so it's able to be accessed at that critical point when a patient can't speak for themselves, and if nothing else, gives the family, it's a conversation that the family can be used in a conversation with the family.
Be referred to and maybe take some stress out of what already is a very stressful situation. A lot of great things happen at HEALTHeLINK. So if you haven't signed up, you need to with your healthcare provider. HEALTHeLINK, a collaboration. It's among hospitals, physicians, health plans, and other healthcare providers in Western New York to securely exchange clinical information. It improves the quality of healthcare for patients and folks in our area. To find out more, head over to the website at WNYHealthyLink.com. Join the over 1 million people here in Western New York using HEALTHeLINK today. Now, coming up next.